Most women are unknowingly harming their health every single day just by ignoring one silent factor, pH balance. Doctors say the real signs are subtle but dangerous. What if your body has been warning you all along and you never noticed? My name is Dr. Lauren Bennett, and today our topic is what doctors wish you knew about pH balance and women's health. Before we go any further, I need you to hear this. Nearly 75% of women will experience a vaginal infection at least once in their lifetime. But here is the shocking part. Most of those infections are not caused by something they caught. They are caused by something they disrupted, something invisible, something that was working perfectly until the wrong habit, product, or diet threw it completely off balance. And the scariest part, most women have no idea it is even happening until the damage is already done. So today, I am going to walk you through exactly what pH balance is, why it matters more than almost anything else in your reproductive health, and what you can start doing today, not next week, to protect it. Because your doctor wishes she had 30 minutes with every single patient to explain this. Consider this that conversation. Let us start with the basics, and I promise I am going to make this simple. Your vagina has a natural pH level. pH is just a number on a scale from 0 to 14 that tells us how acidic or alkaline something is. Pure water sits right in the middle at 7. Your vaginal pH in a healthy reproductive age woman should sit between 3.8 and 4.5. That means it is naturally, intentionally acidic. And that acidity is not a flaw. It is a fortress. Think of your vaginal environment like a self-balancing ecosystem, almost like a rainforest. Every living thing inside that ecosystem has a role. The dominant species in a healthy vagina is a group of bacteria called lactobacillus. These are the good guys. They produce lactic acid, which keeps the environment acidic, which keeps harmful bacteria, yeast, and pathogens from being able to survive. It is a brilliant, elegant system that your body designed and maintains all on its own, until something tips the scale. But here's the part that almost everyone gets wrong. Most women think infections come from outside, from public restrooms, from not being clean enough. And so their instinct is to clean more, scrub more, douche, use scented soaps, try every feminine hygiene product on the shelf. And every single one of those actions makes the problem worse because the vagina is self-cleaning. When you introduce alkaline soaps, fragrances, or water from douching into that ecosystem, you are not helping. You are flooding the rainforest. You are killing the lactobacillus. You are raising the pH. And the moment that pH rises above 4.5, harmful bacteria have an open door. This is how bacterial vaginosis develops. This is how yeast infections spiral. This is how chronic irritation starts. Not from being unclean, but from overcleaning in the wrong way. Now, let me describe something, and I want you to pay close attention because this is the that's me moment a lot of women experience but never connect to pH. You notice a subtle change in discharge. Maybe it is a little more watery than usual, or there is a faint odor that was not there before, but it is not strong enough to make you worried. You feel a mild itch that comes and goes. You are a little more tired than normal, which you blame on stress or sleep. Your cycle might feel slightly off, heavier, or you have more cramping than usual. You chalk all of it up to a busy week. Sound familiar? These are early signs that your vaginal microbiome is under stress. And most women wait until those symptoms escalate into full discomfort before they seek help. By that point, the imbalance has often been going on for weeks. If you only remember one thing from this video, let it be this. Your body gives you quiet signals before it gives you loud ones. Learning to listen to the quiet ones is how you stay ahead of your health. So what actually disrupts pH? Let me give you the real list that most people are not talking about. Number one is your diet. A diet high in sugar feeds yeast. Candida, the organism behind yeast infections, thrives on glucose. When your blood sugar spikes regularly from processed foods, white bread, sugary drinks, and candy, you are essentially feeding the organism that causes your infections. A diet rich in probiotic foods, think plain yogurt with live cultures, kefir, sauerkraut, kimchi, actively supports the growth of lactobacillus throughout your gut and your reproductive tract. Number two is antibiotics. This is one of the most common and least discussed causes of yeast infections in the US. Antibiotics do not discriminate. They kill bad bacteria, yes, but they also wipe out your good lactobacillus colonies. If you have ever noticed that you get a yeast infection after a course of antibiotics, this is exactly why. Ask your doctor about taking a probiotic, specifically one with Lactobacillus rhamnosus or Lactobacillus reuteri, during and after antibiotic treatment. Number three is your menstrual cycle itself. Blood has a pH of around 7.4, significantly more alkaline than your healthy vaginal environment. During your period, your pH temporarily rises. For most women, this is fine. But for women who already have a slightly compromised microbiome, this monthly pH spike is enough to trigger a recurring infection every single cycle, like clockwork. Number four is sexual activity. Semen is alkaline, with a pH between 7.2 and 8.0. Unprotected sex can temporarily raise your vaginal pH and alter the microbiome balance. This does not mean sex is harmful. It absolutely is not, but it does mean that staying hydrated, urinating after sex, and supporting your microbiome with probiotics is especially important if you are prone to infections. Now, why is this actually dangerous? Let us look at the data. Chronic pH imbalance is not just uncomfortable. Research has shown that a disrupted vaginal microbiome significantly increases susceptibility to sexually transmitted infections, including chlamydia, gonorrhea, and HIV. A 2020 study published in PLOS Biology found that women with low lactobacillus dominance were nearly 5 times more likely to acquire HIV upon exposure compared to women with a lactobacillus dominant microbiome. That is not a minor footnote. That is a public health finding that deserves far more attention than it gets. Beyond infection risk, untreated or recurring bacterial vaginosis has been linked to preterm labor in pregnant women. The inflammatory response triggered by bacterial overgrowth can affect the cervix and the membranes surrounding the baby. This is why OBGYNs screen for BV during prenatal visits, not because it is a minor nuisance, but because the consequences can be significant. But here's the part that almost everyone gets wrong about treatment. A lot of women self-diagnose and self-treat with over-the-counter yeast infection creams, and they use them for what is actually bacterial vaginosis. These are two completely different conditions. Yeast infections are fungal. BV is bacterial. The treatment for one does nothing for the other, and using antifungal cream on a bacterial infection delays proper treatment and can worsen symptoms. Please, if you are not sure which you have, see your provider before reaching for the pharmacy shelf. Now, let me address 3 trends circulating on TikTok and Instagram that I see constantly and that I need you to step away from. Trend number 1, boric acid suppositories as a cure-all. Boric acid does have legitimate evidence-based uses, specifically for recurrent yeast infections that have not responded to standard treatment, and it should only be used under medical supervision. But social media has turned it into a casual daily supplement, and women are using it without any diagnosis. Boric acid is toxic if ingested, dangerous during pregnancy, and can cause irritation and burns to vaginal tissue if used incorrectly or too frequently. This is not a wellness hack. It is a medication that requires medical guidance. Trend number 2, putting yogurt directly inside the vagina. I understand the logic. Yogurt has probiotics. Probiotics support lactobacillus, so why not go straight to the source? Here is why not. Commercial yogurt contains sugars and proteins that can feed yeast and bacteria you do not want. It introduces a non-sterile substance into a sensitive environment. The strains of lactobacillus in most yogurts are not the same strains that colonize the vagina. Eat your yogurt. Do not use it topically. Trend number 3, using diluted hydrogen peroxide as a vaginal wash. This trend has gained momentum as a natural BV remedy. Some older studies did suggest limited benefit, but more recent and comprehensive research shows that hydrogen peroxide disrupts the vaginal microbiome in unpredictable ways and can cause oxidative stress to vaginal tissue. It is not a safe or reliable solution. If you have BV, you need metronidazole or clindamycin, prescribed medications that actually work. So let me give you the actionable protocol. Here is what supporting your vaginal pH actually looks like in real life. For your diet, reduce added sugar, increase probiotic-rich foods, stay well hydrated, and consider a high-quality oral probiotic with Lactobacillus rhamnosus GR1 and Lactobacillus reuteri RC14. These are the 2 strains most studied for vaginal health. For hygiene, wash the external vulvar area only with warm water or a fragrance-free, pH-balanced cleanser like Cetaphil, or a specifically formulated intimate wash. Never douche. Never use scented soaps, sprays, or wipes internally or externally. For your wardrobe, wear breathable cotton underwear. Moisture and heat are the 2 best friends yeast has ever had. Avoid staying in wet swimsuits or workout clothes longer than necessary. For sexual health, use condoms consistently, urinate after sex, and speak openly with your partner and your provider about any recurring symptoms. And finally, track your body. Note when symptoms appear in relation to your cycle, your diet, antibiotic use, or other changes. That information is clinical gold when you sit down with your doctor. Here is what I want you to leave with today. Your body is not broken. Your vaginal microbiome is one of the most sophisticated protective systems in human biology. The goal is not to sanitize it. It is to support it. Every product that promises to make you smell like roses is working against a system that already knows exactly what it is doing. You deserve accurate information. You deserve to understand your body without shame or confusion. And you deserve a healthcare provider who takes your concerns seriously. If you do not have that yet, keep looking because you will find one. This content is for educational purposes only and is not a substitute for professional medical advice. Always consult a healthcare provider.